next very important topic is MCH indicators, maternal and child health indicators. Now tell me, what is the importance of MCH indicators? MCH means mother and child. We know that mother and child should always be seen as a single unit because mother's health has got a definite stake in child's health. That is why we always talk about mother and child together, right? And my question was, what is the importance of this mother and child? They are the most vulnerable population, right? That means any change in the community will be first reflected in the mother and child because they're so sensitive and they are so vulnerable that these are the groups which are affected first. So you call them as vulnerable. So this vulnerability makes MCH indicators very important because these are considered as the most sensitive indicators because the change will be first reflected in mother and child. That is why we are always talking about MCH indicators. By the way, what do you mean by indicator? What is the use of indicator? Indicator means, we have already discussed in earlier classes. Indicator means, it shows, indicator, left indicator, right indicator. It shows the direction of progress, right? Whether it is going towards the left or right, as in the case of a vehicle. Similarly, health indicator means by looking at the indicator over the years, you know whether the health is progressing or whether it is deteriorating or whether it is going as such. All this information you will get by monitoring these indicators over the years. Okay, so let's see what are the mother and child indicators. We'll start with mother indicator first. Which is the mother indicator? The most important is MMR. What is the full form of MMR? Maternal mortality. What is R? Not rate, it is ratio. Okay, maternal mortality ratio. Ratio means you have numerator and denominator, and numerator is different from denominator. So what is the formula for MMR? See, this is important not only for your theory, but even in practicals, you will have to do some problems based on these formula. Okay, so let's have an understanding of what it is first. The formula for MMR is number of maternal deaths in an area during a given year divided by total number of live births which happened in that area in that year into 1 lakh. I repeat, number of maternal deaths in the numerator divided by number of live births in the denominator into 1 lakh. Now, what do you mean by this? What do you mean by this? This is the formula. Now, what do you mean by this? This means that when 1 lakh children are born alive into a population, how many maternal deaths are happening? Okay, when 1 lakh children are born alive into a population, how many maternal deaths are happening? In all the other indicators, especially the child indicators, and we have already seen some other indicators, right? Like crude birth rate, crude death rate, in many indicators, we have seen that the multiplier will be 1000. Whereas in MMR, it's not 1000 guys, but it is 1 lakh. May I know the reason? It was 1000 earlier when lots of maternal deaths were happening. But now, the maternal health has improved a lot that even after 1000 or 10,000 live births, not even a single mother is dying. So, if you use 1000, the thing is, you may have to depict it as, in decimals or in fractions like 0.1 maternal death per 1000. It doesn't sound good, right? So, to make it as whole number, we have increased the multiplier to 1 lakh so that you can say, okay, per 1 lakh live births, this many number of maternal deaths. Hope I am clear. The multiplier is 1 lakh only because this is a rare event. Are you understanding? You may have to take 1 lakh for getting a single digit. Okay, that is the only reason. Now the question is, what do you mean by maternal death? What do you mean by maternal death? There is a definition for maternal death. A pregnant lady who's dying while she's pregnant, or at the time of delivery, or after termination of pregnancy or after delivery. For how long? For 42 days or till 6 weeks after delivery. The death happening while she's pregnant or at the time of delivery or after delivery for 6 weeks or 42 days. That is maternal mortality or maternal deaths, but not from accidental or incidental cause. Okay, so that means suppose a pregnant lady is dying in an accident. Okay, can you call it as maternal death? She died in a road traffic accident. Can you call it as a maternal death? No. Suppose she is committing suicide. Can you call it as a maternal death? No. I hope the message is clear. Okay, so maternal death is defined as the death of woman while she is pregnant or at the time of delivery or within 42 days of termination of pregnancy from any cause related to pregnancy. Okay, from any cause which is related to pregnancy and not from accidental or incidental cause. Okay.